Hey everybody, we are now all as a country, most of us have been quarantined or on lockdown due to COVID-19 for at least a month. I know that for a lot of my warriors, we have been in self-isolation or quarantined for, even longer. And this is just a really uncertain time and a scary time for everyone. I know that with the loss of jobs, I'm a small business owner. Most of my friends are small business owners, and we're not really sure what the future holds, especially once things hopefully resolve with the coronavirus, what our new normal will look like. It's all very scary, and there's a lot of anxiety, just around all of it, thinking and praying that your loved ones stay safe and healthy, not being able to see your loved ones. There's just so many levels and layers to the stress of this situation that we're all going through. And I wanted to take the time to actually address something that people with autoimmune diseases, as we are a part of that compromised group, are going through, which is deciding how to get our medicine and how to continue the treatment and managing our diseases. Just to give a little bit of background for those of you that you don't know, there are disease modifying therapies, which are abbreviated as DMTs, which a lot of folks with MS are on. There's several different kinds. I am on Ocrevus, which is an intravenous drug that I get once every 6 months. And it's something that helps prevent new lesions from growing, as well as trying to keep your current symptoms manageable and down. And so again, it's something you get twice a year. You go into the hospital. Usually it's an ambulatory infusion floor, or center, and you hook up to an IV, and it's about a half of a day to a full day process. I really struggled with Ocrevus. I have only had one full dose. When you first start, they break your dose in half to just see how your body adjusts to it. And I really struggled. My first half dose should have just been 4 or 5 hours. I was actually there for 10. My body really reacted strongly to the drug. Me in particular, I'm pretty sensitive to a lot of things. I'm allergic to ibuprofen, for example. There's a lot of just sensitivity and allergies to medicine that I already hold and carry, and I'm sure that there are other people out there that have that same kind of sensitivity, and I wanted to just talk about my experience with Ocrevus and hopefully help you prepare for yours. When I talk about reactions, my face broke out into hives, my blood pressure dropped severely low, and it was just a really miserable kind of experience. I was told that because it was my first time, maybe it wouldn't be so bad the next time, that my body would kind of adjust and it would be okay. That wasn't the case. When I went back in 2 weeks later for the remainder of my first dose, I had just as bad reactions. Throat starting to close up, hives again, blood pressure dropping. I became physically ill at the first kind of dose of steroids that they give you before they even get started. So within 10 seconds, I was vomiting, and it was still just this miserable experience. And I was really scared because these were just half doses, and I wasn't sure what was going to happen or if my body could handle, a full dose. I know that some of you listening to this might be thinking, well, why would you even consider continuing? Why not switch drug therapies? And Ocrevus, for now, has been listed as the most aggressive and most successful way to stop new lesions from growing. And as I am new to this disease, I have completely rejected any possibility of myself becoming even more hindered than I already am. And so when I learned about Ocrevus, when my neurologist shared this as an option, I wanted to go straight for it. That's just my personality, is to kind of get something head on. As soon as I was ready to actually begin treatment, I just wanted to, go full stop. So I really wanted to figure out what could I do with this drug to make it where I could have an easier time. And I was so frustrated that my neurologist didn't have any answers for me, and that it was just this experience that was so scary, so horrible, so painful, that I was just gonna have to continue to go through. I wasn't okay with that. So I decided to reach out and find some answers on my own. As I mentioned before, I was diagnosed while I was on vacation. I was actually in Boston, at Martha's Vineyard, to be exact, and wound up at Brigham and Women's Hospital. And Dr. Jonathan Zareski is who became my neurologist while I was first admitted. So I reached out to him and asked him what his opinion was, if he had ever dealt with patients that had such a bad experience with Ocrevus, and could he help me out or give me some advice. So I feel like maybe we'll back up and I'll walk you through what happens when you normally get Ocrevus, and then we can run through the tips that I received that really helped me. So typically you go, as I said, to the infusion center, you check in. They first give you a Benadryl and Tylenol to help with those side effects that I mentioned. And then they give you a shot directly into your bloodstream through the IV of Solomedrol, which is a steroid. And so this steroid is supposed to just kind of help any inflammation that might be happening. Steroids are what we take when we are in flare to kind of calm things down. So they usually start off with that to just get things settled. So for me, if you recall, I threw up as soon as it went into my veins. It wasn't something that I could really handle. And so that also meant I had thrown up the Tylenol and the Benadryl. So we kind of had to start all the way back over to make sure that everything was, kind of back in my system. After that, they hook you up to the Ocrevus bag, and it basically does kind of a time lapse of a release of the fluid into your system. And so they kind of check you out, make sure you're not having any reactions, and they will increase the flow that it's dropping, from the IV bag, into your bloodstream. And you're very drowsy, very out of it, from the Benadryl to, the drug itself, really just kind of loopy. It's hard to fall asleep. So you're just kind of in this drug-induced kind of haze. And again, a half dose is about 4 to 5 hours, and then a full dose should be anywhere from 6 to 8 hours. So I had so many issues with the process, we would have to stop and restart. And that is what wound up having me be, at the hospital for 10 plus hours. So Dr. Zareski was really helpful, and I'm going to have this up for you as well. He said that, a lot of people struggle with this, and there's a pre-medication kind of protocol that you can use and that he recommends for his patients. So he sent it over for me to share with my neurologist to see if it was a plan that we wanted to put into place. The biggest thing he said that was really helpful was, instead of getting the shot of the steroid, the Solomedrol, to go ahead and get 1,000 milligrams intravenously. So before even beginning, set you up with a bag of the Solomedrol to be dripped into your system. That's going to add an extra half hour to hour to your infusion process, but that way it gets into your bloodstream, you're not having that reaction, and it can kind of help calm everything down. So that was the kind of like the first step, is adding on an intravenous process for the steroid. But then there's a lot of work that you're kind of doing beforehand and the day of. So the night prior to my infusion, he recommended 10 milligrams of cetirizine and 75 milligrams of ranitidine. Those are the fancy words for Zyrtec and for Zantac, which is for kind of acid reflux, heartburn, and then Zyrtec for allergies. So taking those the night before, making sure to stay hydrated. I typically drink about 3 liters of water a day anyway, but he was recommending closer to 4 liters and starting that maybe a couple of days before going in. You want to be as hydrated as possible to just make sure that the rest of your levels stay like where they should be. So adding in that hydration, and then the morning of your infusion, go ahead and take that Zyrtec and that Zantac again, 10 milligrams and 75 milligrams, and also take 50 milligrams of prednisone, which is an oral steroid. So it's kind of getting yourself prepped before going in to not have any of these inflammatory responses. So it's taking your Zyrtec and your Zantac the night before, taking a 50 milligram pill of prednisone, which you'd have to get prescribed, from your doctor, and then starting the morning on another round of that Zyrtec and Zantac to just kind of help keep things, at bay. And then once you get hooked up, you do that 1,000 milligrams of Solomindrol, and then from there, you can actually begin the Ocrevus. And it's not really a fun experience, but this made my full dose go so much smoother. I checked in at 7:30. We were done by 1:30. I was able to get up to the full speed of the Ocrevus actually, coming into my system. I didn't have hardly any reactions, maybe, a little bit of an itchy throat, but it was just such a smooth process, and it was such a relief to know that there, were answers and that I didn't have to suffer. And I think that's really how I want to close this out for you when you're thinking about any of these treatments, or when you're thinking about, what it is that you want to do before you do it. It's just knowing that if you don't get an answer that you like, from the first person, get that second opinion. Find out, where there's someone else like you. I know this is a snowflake disease, but someone has been through this. Someone has struggled as well, and there's protocols in place. And, as soon as I asked just one other doctor, he sent me over 3 pages, of instructions of how I could have a better experience. And so it's not kind of just like taking that first recommendation or that first answer as like the only answer. And this is a scary time for us because these disease modifying therapies are wiping out our immune system. And I waited 2 months to decide to go ahead and go in, for my Ocrevus treatment. I was scheduled for the kind of mid-March timeframe. It was postponed when most of the city was put in shelter in place because it wasn't safe for someone like me to go into the hospital and, get this kind of a treatment, nor was it safe for me to be even more compromised, post-treatment. And as this time has gone on, we're still here. We're still in shelter in place, and, I need my medicine. And I know that a lot of you might be going back and forth with your doctors about whether or not to try to push through or to go in and get your medicine. And it's really, your choice. It's something that you have to think inside yourself and pray over about if it's something that you're willing to do and if you feel that it's safe to do. And just do every precaution that you can think of, just making sure everything is as sterile as it needs to be, arranging your transportation to be, again, as sterile as it possibly can. And just have the faith that we've been through so much already that this is something that we can absolutely conquer. I'm looking forward to my next dose so that I can be ready and strong, and no fear. Thanks, guys. Good luck.